Fellow citizens living in France and also in the overseas territories, the health crisis that we are currently living through, the Covid-19 crisis, has been lasting for 1 year now. A year of great pain, sorrow, trying times. 4.5 million of us have contracted the disease. 100,000 families mourning. A whole year of considerable effort, sacrifice from all of us. Heroic acts. 1 year where together we resisted and we learnt. We held strong. I said at the very outset that we would have to learn to live with this virus, and that is the case. So tonight I speak to you. I speak to you with a determined spirit and with a humble word. To ask of you to say that we will need to hold on for longer. And I will be able to talk through the next steps with you and to say to you that if we stand side by side, if we show signs of solidarity, then yes, we will see the light at the end of this tunnel. I'm speaking to you this evening to remind you of the importance of the month of April and how it is so important for all of us to act. So where are we currently standing? We had a first initial lockdown, which was quite hard on all of us. And then we had an adapted lockdown in autumn. Since the beginning of this year, since the beginning of 2021, we have chosen to find a response to limit the spread of the virus without going into lockdown. There were 3 major principles that guided all of us. Safety, to protect each and every one of you, to never give in on protecting your health, to ensure that you could all seek medical care in the best conditions. The second principle, one of balance. We had to take into account the consequences that those restrictions would have on our children in their education, on the economy, on society at large, on our mental health of the younger generations. We had to ensure that we would not penalize those areas of France where there was very little virus. The third principle, one of responsibility. We had to show trust in you. We had to believe in all of us being able to live civically minded, to limit our contact, to test whenever we had symptoms, and to isolate whenever you did have symptoms and you had the virus. So these 3 principles guided us, which is why in January we chose to use the strategy alert, test, protect, to shut down certain establishments, instead of going into widespread lockdown. We all agreed to that. And we all saw your efforts. And yet the virus has continuing to circulate, even today. But where many of our neighbors chose to go into lockdown, some 4 months ago, in Germany, for example, where in Italy, we can see that they're moving into their 4th lockdown. We chose, as a united whole, to be able to live in a sense of freedom, to be able to have hundreds of thousands of workers still going to work, to keep their head above water without losing control of the virus. And I truly believe that we acted rightly. To believe in your responsibility, your sense of responsibility. I believed in it. These past few weeks, we have seen new data coming through. In the early days of this month, we saw that we are faced with a race against the clock. We can see that the numbers are charging away from us, and we can see that the virus is spreading also around Europe. A new form of the virus, one which was identified first in the United Kingdom at the end of last year. This new form of the virus has created an epidemic within the epidemic, and it is extending further than back in last spring, which means that everyone is at risk. And it is also probably more dangerous than what we experienced back in fall, in the autumn. It is more deadly. When we look at the resuscitation wards, we see that people are coming in good health, 60, 50 years of age, sometimes even younger. 44% of patients in resuscitation wards are under the age of 65. So given this current context, on the 18th of March, we took a decision for 20 of our French departments to go under further restrictions, on top of the ones which are already in effect. 2 weeks after implementing those restrictions, we saw the figures. Yes, we saw the early effects of that strategy, but quite clearly, those efforts were not enough, given the time we were in, where the virus was accelerating, and it was growing at a faster pace. And all of this because there was the new variant that was hitting the ground, which was spiraling out of control. And so for the coming months, we are in a new form of framework. And we mustn't give in to panic, because we have been able to keep control of the situation within our hospitals. It is very tough, and many of our hospitals are overburdened, but we haven't lost control. We mustn't give in to neither denial. We mustn't just bury our heads in the sand, because we shouldn't just hope that things will improve of their own accord. Therefore, if we do that, then the whole country will be overrun and overwhelmed. And so we have to deal currently with the sick, and we have to protect the future of our younger generations. And for that, for the coming months, we must, each and every one of us, put in additional effort. This is what I am calling on you as a whole this evening. For our medical staff, we will increase capacities in resuscitation wards. I would like to take my hat off to all of your efforts, the remarkable efforts of our medical staff, especially those working in ICU wards, resuscitation wards. Be they in the public or private sector, they are working tirelessly together. They're pooling their resources together. They're innovating, not just to deal with the COVID cases in hospitals, but also by transforming operation wards into resuscitation wards so they can continue providing medical care for people with serious disease such as cancer, amongst others, so that all of us, all of those patients will have the best medical care possible, the medical care that they need. In March last year, we applauded them. But do not forget that for the past year, they have continued to work tirelessly. We have been able to increase the number of people taken into medical care for unprogrammed medical care. And this will be boosted in the coming months by further staff. We now have 7,000 additional beds. I would like to thank all of the medical students, people coming out of retirement, military medical staff, all of those working for the reserve medical forces, all of those people who have put in extra efforts to ensure that in the coming days, we will be able to take up capacity to 10,000 beds. We will be able to open up new capacities in hospitals in Paris. The second major effort, one that is for all of us to heed. We currently have rules that are in place in those 19 departments with heightened restriction measures. They will be extended across France as of Saturday evening for 4 weeks. Now, we have chosen not to focus on our overseas territories, where the virus is circulating at a lesser rate. And these are areas where the people have worked hard for the past few weeks to really slow the virus down. So these measures are for all of mainland France. And the reason for that is because every department is affected. Wherever the virus is spreading faster, and everywhere where we are seeing more people being hospitalized. So therefore, everyone must be careful. They mustn't. We don't have to lock ourselves in, but just limit the number of people you see, limit the contact you have. What that means, that the curfew at 7 p.m. will extend across mainland France. Remote work, which is probably the most effective solution at our disposal. It will be made systematic. And I call all those people working from home, or who can work from home, to do so. Shops will be closed across France, according to the list that has already been laid out for the 19 departments that are currently under additional restrictions. People who wish to move between regions for lockdown will be able to do so during Easter and the Easter weekend. French citizens abroad who wish to return to France will be able to do at any point in time. And to be able to, we need to ensure that we can still have cross-border workers who can still travel across borders.
De l'attestation, comme en mars 2020. Nous n'avons pas retenu cette option.
We chose not to go to the previous form of having a written certificate to be able to move around. And what we have seen is that there will be additional checks and patrols in the streets to check against those people who are grouping together in large groups and drinking alcohol in the streets. This is a choice we've made. We chose to trust in you, and therefore the certificate will only be obligatory during daytime if you travel for more than 10 kilometers. This time of year is one of many public holidays and religious holidays. So I call on you to try and avoid, just as we did back in Christmas, to meeting in private, to attend parties and celebrations with friends and family. I really insist on this point, because it is at such moments when we infect others at such a high rate. It is an effort to protect yourself and others. In terms of schools, and this is the second major area of effort that I'm calling on you, in terms of schools, we must uphold a sense of duty towards our younger generations. We were one of the first European countries to open up schools back in last year, and we have been able to keep those schools open since September of last year. We are one of the rare countries who chose to do so, even though we were one of the hardest hit by the disease. And we did it knowingly, because we believed in the investment that it is to teach our younger generations. Education is so important for them, because they will lead the fight for the coming century. They need to be together to learn. And we all know what a prolonged closure of these schools would have on our younger generations, because it would only further dig deep the trenches of inequality in our society if we were to do so. So the education of our children is non-negotiable. School is non-negotiable. Which is why we need to take full responsibility of our actions. Yes, we need to hinder the spread of the virus. So we will close down daycare centers, primary schools, middle schools and high schools for 3 weeks. So yes, we do still need to preserve education and apprenticeships, which is why the school calendar will be adapted in a way so that we will not leave our younger generations alone without education. So what that means is that next week, classes for primary schools, middle schools and high schools will be done from home, except for those children of medical carers, as was the case back in spring of last year. Those students will be able to attend school as usual. And they will be taken in 4 classes in establishments set up at the socio-medical sector. As of the 12th of April, all across France, no matter what holiday zone you are in, will go into the spring holiday break. Therefore, everyone will go back to school on the 26th of April, in person for kindergarten and primary school, remotely for middle and high school. As of the 3rd of May, middle schoolers and high schoolers, they will be able to go back to their school buildings, obviously by expecting the limited number of students per classroom. Having reorganized the calendar as such obviously implies considerable changes for parents and families, but that is the best adapted solution we have found, because we are able to limit the spread of the virus, but still ensure that our younger generations get an education. University students will be able to attend classes at university for 1 day per week. So this evening, on behalf of you all, I wish to thank all of our teaching staff and all of the support staff in schools, middle schools, high schools, in specialized schooling establishments as well. Because France was, as I mentioned, one of the countries that closed down its schools the least, 42 weeks open, which is much more than our European neighbors, and it's all thanks to you.
L'accompagnement économique et social sera au
For the
rendez-vous.
past year, we have provided economic support and we will continue to do so. For parents who cannot do remote work, will be able to have short-time work contracts. For independent workers, for entrepreneurs, for small businesses, everything that is currently in effect will be continued.
Je sais combien les efforts que je vous demande sont difficiles.
I know that I'm calling on you to put in considerable amounts of effort, and I know it will have considerable consequences on our country and on your
Que
lives.
nous avons tout fait.
But as you know, we have done all that we have been able to do to push this decision back as
Au
much as
moment où elle
possible
devenait strictement nécessaire.
and to push it back until the absolute latest date possible.
Mais je
And
tiens
that date
en même
is
temps à
today.
vous dire ce soir que grâce à la
So
vaccination,
I want to tell you
la
today that
sortie
thanks to
se
vaccines,
dessine.
the end of this crisis
Parce
is
que oui, à
on
cette
the
heure,
horizon.
vous êtes déjà plus de 8,5 millions à
More
avoir
than 8.5
reçu
million
une
of you have
première
already had a
injection de
first
vaccin.
injection.
3 millions
3
à en
million
avoir reçu 2.
have already had 2 injections.
Et le vaccin est efficace.
And the vaccine
Il l'est
is
au bout de 15
efficient.
jours.
It's efficient and effective as of 2 weeks after the
La meilleure
first
preuve
injection.
d'ailleurs de cette
The
efficacité.
best proof of the effectiveness of this
dans les
vaccine
chiffres
can be seen
que
in the
vous voyez
figures
à
that
cet
you
instant
see
à votre
on the
écran.
screen
Et dans la mortalité en
We can
particulier de
see
nos
the
concitoyens de
death
plus
rate
de 80 ans qui ont
of those people
la
above the
mortalité
age
qui a
of
très
80
fortement diminué.
is a death
La
rate that
meilleure
has dropped
preuve,
considerably.
elle en est d'ailleurs dans la situation
We can
des
see the
résidents
proof
des
of this
maisons de retraite
in the
qui,
way
vaccinés
people
à
are
plus de
living in
90%,
retirement homes where we have a 90% vaccination rate and they are able to get back to normalcy.
Notre enjeu principal aujourd'hui,
So our
c'est donc
main issue today
d'accélérer
is to
encore
accelerate
et encore.
more and more,
Cette
to
mobilisation,
roll out
c'est celle,
the vaccines
évidemment,
faster and
du
faster.
gouvernement,
So it is up to
de nous
us,
tous,
the government, but
et de
also
tous les
to all of
soignants,
you
là
and to all of the
avec
medical
une stratégie
carers as
claire.
well to have a
D'abord,
clear strategy.
continuer à avoir de plus
We'll
en plus de
continue
doses
to have
en
more doses
accélérant nos
available.
achats et
We'll
surtout
continue
en
purchasing
produisant en France
at a
et en
faster
Europe.
rate vaccines, those
Nous
produced
sommes
here in
pleinement
France and
mobilisés.
Europe.
Il y a eu des
We
retards,
are mobilized. Yes,
il y a
delays
eu
have come into
des
effect.
choses que nous avons corrigées, et je pourrais y revenir.
There are
Dans les
areas that
semaines à
have to be
venir, nous
corrected,
allons encore accélérer le nombre
but
de
we will
doses
be
que
able
nous
to
obtenons, et nous
accelerate the
allons
number of
progressivement
doses we will
devenir
receive,
le premier continent au monde
and
en
we will
termes de
become the
production de
leading
vaccins. C'est construire notre
continent
indépendance,
in the world in
c'est
terms of
garantir
vaccine
que s'il
production.
faut des doses supplémentaires,
That
nous ne
way, if we
dépendrons plus
need
des autres.
additional doses,
C'est
we will no longer
garantir
depend
aussi
on
la
others.
production
It guarantees
de nouveaux vaccins
production of
s'il y
new
avait à
vaccines.
nouveau à l'automne,
So-
hiver ou l'année
and that
prochaine.
is perfect. If
de nouvelles
in the coming
vaccinations.
autumn, later in the year, we need more vaccines.
Ensuite, c'est vacciner le plus vite possible
We also
Tous
need
ceux
to vaccinate as
en ont
fast
le
as
plus
possible
besoin.
all those people who need it the
c'est-à-dire
most,
les plus âgés,
the
les plus
elderly
fragiles,
and the
ceux
most
qui ont
vulnerable.
le plus de risques de développer des formes graves.
Those people
Et
who are
j'assume
most
totalement
likely to
cette
develop a
priorité,
serious
cet
form
ordre
of the
que nous avons
disease.
donné parce
And
que
this is the order, the priority order that we have established, because
c'est
that is
ainsi
how
que
we
nous
can
pourrons
ensure that the
soulager
vaccine
plus
program will be
rapidement
as
l'hôpital.
effective
C'est
as
ainsi
possible.
que nous sauverons des vies.
And that is how we will save our
partir de là,
hospitals and save
Nous
lives.
mettons tous les moyens pour vacciner,
So we are
vacciner,
implementing
vacciner, sans
all that
répit,
we can
sans
do
jours fériés,
to
le
vaccinate,
samedi et
vaccinate,
le
vaccinate,
dimanche comme
day
la
in,
semaine.
day out.
Pour les
every
vaccins
day
Pfizer
of
et
the
Moderna,
week.
qui nécessitent des
Pfizer,
conditions de
Moderna,
conservation spécifiques.
they require specific
Il y a
conservation
1700
programs.
centres
There
de
are
vaccination
1,700
ouverts,
vaccination centers that have been
notamment
opened.
grâce à l'engagement exemplaire
And that
de nos
is
maires que je veux
much thanks
ici
to the support of all of our
remercier
mayors,
une fois encore.
our local officials that I would like to thank.
Pour les vaccins AstraZeneca,
As for
et demain
AstraZeneca
Johnson & Johnson,
and Johnson in the
tous les
near
médecins
future,
généralistes,
all
pharmaciens,
general practitioners,
infirmiers et
pharmacists,
infirmières sont
nurses will be able to be
Au total,
mobilized. All in
250
all,
000 professionnels,
250,000 medical
médecins,
professionals,
sapeurs-pompiers,
doctors,
infirmiers, vétérinaires sont aujourd'hui prêts à
nurses,
contribuer à ce grand effort.
pharmacists, they are all going to be part of that
Si vous avez
nationwide
plus de
effort.
55 ans et êtes atteint
If you are
par
of the
exemple
age
de
of
diabète,
55 years,
d'hypertension
if you
ou de
have
surpoids,
diabetes, high blood pressure,
pouvez
or you are overweight,
aujourd'hui
you will be able to,
prendre
as of
rendez-vous
right now
auprès de
today,
votre médecin,
take an
votre infirmier,
appointment,
votre
book an
pharmacien,
appointment
qui
with
vous
your
vaccinera
doctor, with a
directement
local nurse,
avec
with
le
your local
vaccin AstraZeneca.
pharmacist, to be
Cela a
able
commencé
to have the
depuis
AstraZeneca
la semaine
injection.
dernière,
It
et nous
started
allons
last week,
accélérer
and we'll be able to
à mesure
accelerate
que
that
les doses seront
faster as we receive doses.
Les 1700 centres ouverts
The 1,700
sont à
centers that have been
disposition
open are
pour eux
available
vacciner avec les vaccins
to
Pfizer et
vaccinate
Moderna.
using
Et aujourd'hui,
Pfizer and Moderna
vacciner
vaccines
donc tous nos concitoyens
all those
qui ont
people
plus de 70 ans.
who are over the age of
Les
70.
les vaccinations sont en cours et elles
Vaccinations
accélèrent
are already underway and are being ramped
Je
up
sais
as we speak.
que beaucoup de nos aînés ont essayé de prendre
I know that
rendez-vous pour
many
se faire
of the
vacciner ces
elderly
dernières
people around France have tried to book an
Trop
appointment these
souvent,
past few
ils sont
weeks,
fixés.
and far too
Et j'en
often they
suis
were
profondément
unable
désolé.
to get an appointment, and I am so sorry for you.
C'est pourquoi j'ai
It is
demandé à
unacceptable,
l'assurance maladie
which is why
de
I called
mobiliser des
on the
équipes
social
pour y
security medical sector
Depuis
to
quelques-
mobilize
Si vous avez
agents,
plus de 75
mobilize
ans,
staff,
vous avez peut-être
to ensure
déjà
that people over the age of
reçu
75,
des
if you
appels,
have,
car l'ensemble des plus de 75
will be able to
ans
book
qui
an
n'ont pas
appointment. They will be
réussi à
calling you.
obtenir
Some
un
of you may have
rendez-vous
already been called
seront
to book an
appelés
appointment.
par nos services.
You will receive a
pour pouvoir
call
le leur fixer.
from
Et en
our
parallèle,
services to be able to
un
book an
numéro
appointment if you
spécial
don't
sera
already
mis à
have one.
disposition
There will
pour
be a
rencontrer.
specific number that
À
you can call if you
du
don't receive a
16
call.
avril,
As of the
les
16th
premiers
of
rendez-vous
April,
seront
the
accordés aux
first
personnes
appointments
qui
will
ont
be given
entre
to those
60
people who are between the
70.
age of 60 and
À
70.
partir du 15 mai,
As of the
les
15th of
premiers
May,
rendez-vous seront
the first
ouverts
appointments will be
pour
open
nos
for
concitoyens
those people
qui ont entre 50
over the age
et
of
60.
50 and
Et à
under
partir de la
60.
mi-juin, les
As of
rendez-vous seront
mid-June,
ouverts à l'ensemble des
appointments will
Françaises et
be
des
open up
Français de
to
moins de 50 ans.
all citizens under the age of
Une
50.
stratégie de vaccination spécifique
This is
sera
a
par
strategy
ailleurs
that we
prévue
have
pour toutes les
implemented, and there will
professions les
be an
plus
additional
exposées,
strategy for all
en
those
particulier nos
workers
enseignants,
who are
que
most
j'évoquais tout à l'heure,
exposed,
mais aussi
like
nos
our
forces
teaching
de l'ordre.
staff, but also our law enforcement officers,
Nous
amongst
tiendrons
others.
l'objectif que je
We
nous ai
will
fixé,
uphold the target
à
that
savoir que
I
d'ici
outlined.
à la fin de l'été,
By the end of
tous
summer,
les Français de plus de 18
all
ans qui le
French
souhaitent
people over the
pourront
18
être vaccinés.
will be able to have access to a
Parce que c'est la
vaccine,
clé pour renouer avec la vie.
because that is how we will be able to get back to
Pour rouvrir
normalcy.
notre pays.
That is how we'll be able to open up our country
Mes chers
once again.
compatriotes, les efforts d'avril d'une part,
My fellow
et le
citizens,
déploiement
everything
de
that
la
we did in
vaccination
April
d'autre part,
and the rolling
c'est
out
cette
of
tenaille qui va
this
nous
coming
permettre
April and the
de
rolling out of the
contenir
vaccine,
progressivement
we will be able to rely on these
cette tenaille
to
qui va
deal
nous
with this new
permettre,
form of the
à
virus.
partir de la mi-mai, de commencer à
As
ouvrir
of mid-May,
progressivement
we
le
will be
pays,
able to progressively
à
open up our country
retrouver
once again.
cette culture qui
We'll
nous
be
a tant
able to
manqué,
get
à
back to
retrouver
the cultural sector that
les
we
lieux de
have missed
rencontre,
so
les
much.
commerces,
We'll be able to get
à
back
retrouver cet art de vivre à la
to
française que sont les
the
restaurants, les
love
cafés
of
que nous
life
aimons tant.
that is so very French, the
reviendrai
art de
vers vous
vivre, going
prochainement
to
pour
concerts,
préciser
going to
un
restaurants,
agenda
going
de
to bars and
réouverture.
terrace
Et pour que
cafes.
chacun puisse aussi se projeter
But to be
avec
able to
plus de
do that, for all of
visibilité,
us to be able to
dans
have a
les
clear
mois qui
vision
viennent.
of the future, we will be
Dès la
able to do
mi-mai,
that.
nous
As of
recommencerons
mid-May,
à ouvrir avec des
we
règles
will
strictes
start
certains lieux de
opening
culture.
some
Nous
cultural centers
autoriserons
with
sous
very strict rules in
condition
place.
l'ouverture de terrasses.
We'll be
Et nous
able
allons
to open up the
bâtir
terrace
entre la
eating
mi-mai
areas
et le début de l'été
so
un
that by the
calendrier
beginning
de
of
réouverture
summer,
progressive pour la culture, le sport,
we
le
will be able to
loisir,
have more sporting
l'événementiel,
venues,
nos cafés et
cultural
restaurants.
venues opening up once
Et
again.
d'ici là,
But until then,
je sais pouvoir compter sur vous.
I know I can count on you.
Mes chers compatriotes, je sais qu'il y a
Fellow
beaucoup
citizens,
de lassitude.
I know that you are feeling
Je sais
fatigued,
qu'il y a aussi
exhausted.
parfois de l'énervement, de
I know
l'emportement,
that
et
there
c'est
is
bien normal.
rage and that people are feeling
Je sais
fed up,
qu'à
and
chaque
it
étape
is normal.
de cette épidémie, nous pourrions
At
nous
each
dire
stage
que
of this epidemic,
nous aurions pu faire mieux, et que nous avons
we
commis
could
des erreurs.
always have looked
ça est
back
vrai.
with hindsight and said we could have done things
Je
better.
sais une chose,
It is true. But
Nous
one
avons
thing I
tenu.
do know
Nous
is that
avons
we
appris.
have held on,
et nous nous
we
sommes
learned
à
from our
chaque
mistakes,
fois améliorés.
and at each point
oui,
on the
Aujourd'hui,
road we
pour le
have
mois qui
learned
vient,
and improved
il nous
ourselves.
faut nous
So in the
mobiliser.
coming months,
Nous
we
mobiliser
need to call on you for
pour
additional
nos aînés
effort.
et les
Do
plus
it for the
fragiles.
elder
Et nous
generations.
mobiliser pour nos
Do it
enfants,
for those who are vulnerable.
pour les
Do it for the
protéger et leur
children.
permettre de continuer
Do
à
it so that
apprendre et
we
leur
can give them the
préparer
best opportunity
le
to
pays,
continue
le
to
continent,
learn
le monde
so that they will
auquel
be able
ils
to
ont droit.
prepare the future that they deserve.
Nous mobiliser parce que le succès
I need you
de
to
ce mois d'avril
do
et de cette
this
stratégie
so that
dépend
April and
de
its
chacun
strategy that we are
d'entre
trying
nous,
to
de
roll out
notre esprit de
will
responsabilité.
be effective because it relies on the
C'est ainsi
responsibility and
que nous pourrons
of each and every one of you. That is the way we will be able to rebuild a
celui qui nous
path to hope.
permettra de retrouver progressivement
That is the way that we will be able to get back to
celui
a
qui nous
normal
permettra aussi
life.
de tirer ensemble toutes les leçons de cette épreuve.
That is the way we'll be able to get back to a time
Mais
where
nous
we can
tiendrons.
learn from this crisis.
Unis.
But we will
et
stand
déterminés.
united, determined.
Vive la République!
Long live the
vive
French
la
Republic, long live France.